For 5 to 7 minutes, you're gonna listen. You've agreed to listen to me. And actually, that's what this whole speech is about, listening. So when I first started considering topics for this speech, I had an idea in mind. But then I wondered if it was too personal. My experience might just be specific to me. But then I realized that this actually happens to a lot of young people, and really most women, and even some men, and then probably again to all of us as we got older. Unfortunately, I can't speak about everybody. I can only talk about what I know, and this is what I know. Young female patients are suffering because doctors with an internalized bias are dismissing what these young women are telling them. To remedy this, doctors need to listen, young people need to speak up, and people who don't agree need to join the conversation. So let's start with the truth. The truth is, you probably haven't realized that there's a problem, or if you have, it's because you personally experienced it. Looking around this room at all the women, I'm sure at least some of you have. So women are going into exam rooms, whether it's with their GPs or specialists like neurologists, and something psychologically interesting happens. They will begin to describe their problem, for example, a loss of coordination and balance when it comes to dance. And the doctor will interrupt them, saying something like, well, can you do a pirouette? In a joking yet mocking manner, the patient will begin again, and the doctor speaks over her, more loudly this time. Well, if you can, then I don't really see the problem. At some point, he mentions her menstrual cycle and attributes her complaints to that. Because of situations like this, women go years without diagnosis. According to a 2014 study done on over 2,000 women, 65% said that they felt like their pain was taken less seriously because they were female. This is what happens when an internalized bias is coupled with laziness. Truth be told, it's much easier to say, okay, well, you're just another hormonal teenage girl, it's nothing serious, or it's just another hysterical woman overreacting. In fact, this is something pretty similar to what was told to me when I had to go to the emergency room for face paralysis after I had a seizure. By the time it was my turn, the paralysis had died down. So all that they told me was that I had anxiety and that it was normal for girls my age. So you might be asking yourself, is this fair to everybody, or how does this apply to you? Well, even if you aren't a young female patient that is constantly being dismissed, everybody is a patient. So while you might not experience this as deeply as others, it's still something that affects all of us and something that will help all of us. For example, imagine a classroom. Everyone has an equal opportunity to be heard. If a young female student were to ask a question about the coursework, you probably aren't going to hear the teacher say, well, you're a hormonal teenage girl, so you might be a little bit irrational or psychosomatic right now. Don't worry, if the answer hasn't come to you in 6 months or it hasn't been resolved, come back and ask me again. But if a young boy were to ask the same question, he would be answered right away. Doesn't seem very fair, right? So why isn't it the same in the doctor's office? If doctors do start listening, who will this benefit? Not only will this benefit patients, but also doctors, and hopefully the rest of us. So when doctors start listening, it increases the chance of patients doing what they went to the doctors to do, which is get better. But it also has a mental benefit. Patients see the entire process differently. Now, instead of feeling like just the source of the problem, they feel like a contributor to their healing. If young women know they will be listened to, they now feel like they can advocate and speak up for themselves without the doctor automatically shutting them down, and feel like they have the chance to get better. As for doctors, an immediate or direct benefit is that it's easier for them to do their job. Because of this new and improved relationship with the patient, there's now more trust, which leads to an easier diagnosis, which leads to an easier path of healing. Doctors are now able to help more people more efficiently, even if they are spending more time individually with the patients. When doctors and patients are benefited, they can now take these benefits and bring them to the outside world and benefit others, and that creates goodwill. When you're content and have been helped, you are then able to carry these benefits amongst others. Because when you're a more happy and generally more content person, people will take notice, and it will spread. And maybe the next time you find yourself zoning out or not really listening to someone, you'll remember what it's like to be listened to, and what it's like to not. One of our most basic needs as a human is to be heard, to be recognized by another human. So when you take away that validation, our experience as a human is denied. So now that you've heard the diagnosis, let's discuss prognosis. There are a couple of options, and the decision is ultimately yours. Worst case scenario, you've dismissed everything I've said, and I've wasted 7 minutes of our lives. Better scenario, you've listened, and maybe you'll start a conversation. Best case scenario, something I've said has sparked something in you, and you won't just have one conversation, but you'll have many, and you'll keep having them until something changes. Because it seems to me, our best bet is that you've listened, and you'll get others to listen, and eventually, doctors will listen. And I'm not the only one who hopes that. Let me leave you with the words of other women who've had these experiences and hope to be heard. Maria, age 18. Being a female means needing to go see 10 doctors before getting a proper diagnosis because they always think you're lying or exaggerating. Nora, age 16. It's having my doctor tell my mom not to worry about it. It's just normal teenage girl problems. Meanwhile, if she had just listened, I wouldn't have had to spend 3 years having my brain being inflamed and having antibodies attack it. Kayla, age 15. It's being 13, losing 40 pounds in 2 months, losing your hair, being bound to a wheelchair, and being told it's normal for little girls to be anorexic. Finally, paying to see a specialist, being told you have Crohn's disease, and being rushed to the hospital because you should have died already. Kira, age 23. My friend Leah had back pain, and then pain in her legs, and then in her feet, and then numbness. By the time they found the cancer, it was too late. The cancer spread, chemo and radiation didn't work, and she died and left behind a 5-year-old daughter. Are you listening yet? Thank you for this opportunity.